Thanks, Ron. A new report says U.S. nursing homes are in bad shape. The AARP analyzing federal data and found states need to make some major improvements in order to save lives. Missouri was included on the list. KQ2's Madeline McLean reporting on one of those major problems that needs to be fixed.
Nobody is coming to help. I wish people would really get it through their minds that there might not be a bed for you if you get this.
More than 2,600 people are in Missouri hospitals. The virus has infected more than 305,000 Missourians and killed at least 4,000 of them.
The latest report I read today out of the Hospital Association is that if we keep on this path, we will no longer have any beds available come mid-December.
Heidi Lucas, the director of the State Nurses Association, says beds may be the least of their problems. Staffing is in short supply.
Our nursing staff is cut very, very thin.
From the ICU to nursing homes and everything in between, there were not enough nurses to go around, and the pandemic just made an existing problem worse.
At the beginning of the pandemic, when New York got hard hit, we had nurses from across the country, including some in Missouri, who went out to New York and were helping. Well, now it's bad everywhere.
In a tougher situation is the nursing homes, residential care, and other types of facilities.
And they've been in crisis mode for the last several months, and it's just getting worse and worse.
The fact that Missouri's nursing homes are operating in crisis mode was confirmed in a report released by the AARP. Using federal data, it found that Missouri's nursing homes have more cases and more deaths than the national average.
It just takes one staffer to come in with the disease, and despite all their best efforts, if it happens to get out, that can do enormous damage in a short amount of time in a nursing home.
It also found that Missouri's nursing homes have less staff and PPE than the national average.
They are staffed a lot with LPNs and CNAs, and so those were far worse in a shortage to begin with than our RNs even were.
What's worse than all that?
No help is coming for our hospitals or our nursing homes. That help is not coming.
Reporting, Madeline McLean, KQ2 News.
The federal data used in the report just part of the overall picture. The U.S. government only requiring federally licensed nursing homes to submit COVID-19 data on a bi-weekly basis. No other types of care facilities were included.